The National Conference for Nurse Practitioners virtual event, held November 2nd through the 5th, offers evidence-based presentations that promote clinical excellence and improve the quality of care that healthcare practitioners provide. All sessions will be available to access online until February 3rd, 2022 for you to watch at your leisure. Lippincott Professional Development is accredited as a provider of nursing continuing professional development and will award up to 51.75 contact hours and 34.5 pharma contact hours. Register today. In this episode of the Nurse Practitioner Podcast, Louise Kaplan discusses safe consumption sites. What is a safe consumption site?
It's important to know that safe consumption site is often termed differently by different people or different locations. So it may be referred to as a safe injection site or a harm reduction site or a safe drug consumption site. And these are facilities or locations where people can legally use drugs under the supervision of healthcare professionals who are capable of providing naloxone should an overdose occur. And these facilities also allow for the safe disposal of needles, provide social supports, such as connecting people with treatment programs, and can also connect them with healthcare services for the treatment of infections and potentially help them with housing and other social needs.
What is the basic principle that is the underpinning of safe consumption sites?
This is a harm reduction approach to substance use that parallels needle exchange programs that were instituted to reduce transmission of HIV and hepatitis that often occurs when people use IV drugs and share needles. All states now have laws about access to naloxone to treat overdoses. However, it is not often the case that someone is with a person who experiences an overdose. So the safe consumption site is an opportunity to reduce the harm of overdose by having someone present with a person who is using a drug. And as the opioid epidemic has not abated, and actually as fentanyl, a highly lethal drug, has become more prevalent, safe consumption sites provide the assurance that naloxone will be readily available for a person who experiences an overdose.
Tell us about the use of safe consumption sites worldwide.
The first drug consumption room was established in Bern, Switzerland in 1986. There are approximately 100 safe consumption sites in multiple countries, including Switzerland, Australia, Denmark, France, Germany, Luxembourg, the Netherlands, Norway, and Spain, with Canada being the one country in North America that has operational sites, and Vancouver, British Columbia was the first location in Canada.
Are there any safe consumption sites in the U.S.?
Currently, there are no safe consumption sites that are operating in the United States that are sanctioned. Rhode Island authorized in July of 2021 a 2-year pilot to create what will be referred to as a harm reduction site. And this is not yet operational. The rules are in progress. There have been, however, efforts in other communities to develop safe consumption sites, which have typically been thwarted. And these areas include Philadelphia, San Francisco, Seattle, and Ithaca, New York, and the state of Vermont. There has been a fair amount of contention regarding these, and in fact, in King County, Washington, which is the largest populated county in Washington state, 2 of the communities actually banned the development of safe consumption sites.
Won't a safe consumption site encourage drug use?
This is certainly a concern that is raised often in the discussion of whether or not this is a policy to be developed. And I think it's important to consider that policies and approaches to the opioid epidemic have quite honestly failed. We have used prescribing guidelines, prescription monitoring programs, dosing regulations, insurance policies. We've implemented health professional education, and we've taken action against pill mills. Yet the opioid epidemic still rages. The use of safe consumption sites is an opportunity to build relationships with people who use IV drugs and opioids and connect them with services that will save lives, and evidence indicates there is no increase in use.
Don't these sites make the neighborhoods unsafe?
Actually, studies have documented it's the opposite. Neighborhoods are safer because there are fewer discarded needles in their neighborhood, there's less trash, and there's actually less crime. They actually make neighborhoods safer.
Is this a good use of public funds?
I definitely advocate for this as a good use of public funds, because in the overarching set of policies that would be implemented, money would be saved. And it would be saved in a variety of ways. It would reduce the number of emergency room visits and hospitalizations. It reduces the number of infections that people would incur. It reduces hepatitis C and HIV infections, in addition to abscesses that would potentially develop from people using shared needles. So there are multiple cost savings there. By potentially having people enter treatment, you can also long-term save money in communities that alternately would use the legal system to deal with the issue of opioid use. And it changes contextually the way drug use is viewed. It becomes a health issue rather than a criminal issue. So it does have public funds available to be spent on these sites and reduces the money spent on law enforcement. So I definitely think that safe consumption sites are in the financial interest. Most importantly, these will save lives.
Is there anything else you'd like to add?
I believe as nurse practitioners, we have an obligation to reduce harm and provide evidence-based treatments that save lives. I also believe that safe consumption sites should be legal and utilized to create a safe space where people who use opioids are treated with dignity and respect. I think that's what we as nurse practitioners want to strive for with all of the care that we provide, and people who have a substance use disorder should be treated with the same respect and dignity that any other person should be treated with.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.